Sorting out the needs for insurance as we age can sometimes be a tedious process. That's why Medical Reimbursement Management Services made it their business to help you sort through the options. MRMS President Stephen Buttice and Administrative Assistant Beth Ingle are here with more information. Welcome to Living Well.
Well, thanks for having us. Thank you.
So you literally started the business to help people cut through some of that red tape.
That's how we started in 1984.
Did it come through a personal experience or for your own?
You know, my parents were going through this at that time, but this was more so seeing a need back then where providers weren't filing Medicare. Now we have to remember, 40 years ago, providers weren't filing with Medicare, and sometimes the Medicare supplements back then, they wouldn't be filed upon, and people didn't have the insurance knowledge or availability to access information back then like they have today. So we would help them cut out all the red tape, all the stress, and the frustration of dealing with it all, and help them through that.
So Beth, what would be step one? A lot of folks know 65 is the magic number where I qualify, but I don't know where to go from here.
Well, yeah, it's very important to know how to apply for Medicare. At age 65, if you're already receiving Social Security benefits, you're automatically enrolled.
Okay.
So what about those who are still working? There's a lot of people these days that are still working past 65. Even though they're still working, it's still important to know what their options are for enrolling in Medicare Part A and Part B. Some people can delay their Part B if they're covered by an employer group health plan.
So let's stop you there and say, what's the difference between Part A and Part B?
Medicare Part A is inpatient hospitalization only.
Okay.
It's free to those who have worked and paid into Social Security 40 quarters of coverage or 10 years of work.
And Part B?
Part B is pretty much everything else. It's the doctor part, they call it the doctor part of Medicare. Covers doctor visits, outpatient tests. That's all covered under Part B.
I would imagine you guys do a lot more than just helping people sort through red tape. It's probably an emotional experience for most people, is it not?
It can be very stressful once again, and so what we do through a process of education, we have several different businesses, but this is a medical reimbursement. The idea is to help people understand Medicare, understand insurance, we explain that to them, and help them make an educated choice as to what insurance plans would be best for them, what type of plan, and then specifically what type of company or who they want to deal with. And then we sell and service those plans also.
And you guys are also featured in some local magazines, the Healthy Cells and the 50 Plus News and Views. Can people get more information there as well?
Yes, we've been writing for 50 Plus News and Views since 1987.
Wow.
So it's been a long time. We've also been published in the Illinois Bar Association newsletter. We've spoken at all 4 hospitals here in the area.
Well,
and we've done a lot of public speaking and such.
Well, thanks for the great work that you provide, because I know that can be a very tricky issue for a lot of folks. Let's let folks know how they can get in touch with you and get more information on how to cut through some of that medical reimbursement red tape. 693-1060 is the phone number, or mrms-inc.com. Thank you so very much for being with us on Living Well.
Thank you.